You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. Roland Martin Unfiltered.
Folks, more than 1 million confirmed coronavirus cases in the United States. We now are responsible for 1/3 of all coronavirus cases in the world. Okay? Deaths, 56,387 deaths, 137,465 people who are recovering. So many different stories we're hearing, tragic stories, individuals who are being turned away as a result of coronavirus. We continue to get daily updates from New York State Governor Andrew Cuomo. This is his news conference today.
Monday, this is the total hospitalization rate, which you see is basically flat. Flat is not great, but flat may be a reaction to the weekend. Sunday discharges may be down. But we have the same question: how fast and how steady is the decline? We don't want to see flat. We want to see an increasing decline. And we want to see how fast that decline goes and how low does the decline go, right? When does that hospitalization rate get down to a truly manageable number? When does the incoming case number get down to a manageable number? You see again, overall hospitalization rate is on the decline. Again, yesterday, a little less than we would like to see. But hopefully it was a Sunday anomaly because of the weekend. Intubations is down. Number of new cases, still 1,000 new COVID cases every day. Puts it in perspective. Down a tad from where it was. But again, these weekend numbers sometimes are a little strange. Number of lives lost, 337. Still tragically high. But on the decline, if you look at it over the past few days, not that that gives any solace to 337 families who are suffering today.
Well, folks, remember the White House announced that because of all the negative attention he has gotten from his stupid and idiotic comments, such as disinfectants and putting light through the body, it was just so dumb. The White House announced that they were not going to be holding daily briefings. They said that they canceled one today. Then, of course, Donald Trump cannot help himself, so therefore he had to go before the cameras. And so there's another news conference in the Rose Garden as we speak. No shock, the narcissist was going to hold another news conference. We're not going to go to it because he lies too much. If you see Dr. Anthony Fauci speaks, we'll actually go to it. Frankly, normally we would take Dr. Birx, but she's been defending Donald Trump so much with his idiotic comments that it raises the question, who should actually even trust her voice with what is going on right now? Also, folks, we're here. Alex Azar. Stories came out over the weekend where the Trump administration is looking at replacing him as Secretary of Health and Human Services. Kind of dumb in the middle of a pandemic, you replace your Secretary of Health and Human Services. It has been such a wild weekend with Donald Trump tweeting all kind of crazy stuff, blaming everybody else for what's going on. It's just been utterly idiotic. Also, folks, a really, really sad story out of New York where the top ER doctor at a major hospital there committed suicide because of just the toll on the treatment of various folks. Just a really, really stunning story that we have been following. And again, so we talk a lot about the impact of this on individuals and their families and not being able to see families. But the reality is our healthcare providers are also being greatly impacted by these decisions. I'm going to pull this story up here because I want you to see it. Her name is Dr. Lorna Breen, Dr. Lorna Breen. Here's the, just give me 1 second. I'm going to go to it in a second right now. I want you to see this here because, again, these are the people who are putting their lives on the line to save folks. So go right to the tweet right here. Let's go to it. Dr. Lorna Breen was medical director of one of New York City's top hospitals. Folks, she killed herself on Sunday. She had been talking about how crushed she and other doctors on the front lines were. She especially noted how hard it was not to be able to save COVID-19 patients. Man, that says a whole lot in terms of what's happening, that we would actually lose a doctor. We've seen other stories taking place. We've seen other stories taking place of other personnel folks quitting as well when it came to coronavirus. And so this has just been stunning. In a moment, we're going to talk to a doctor about, first of all, how do we treat children when it comes to coronavirus, but also we'll talk to him about, again, this physical and emotional toll that this pandemic is taking on our healthcare professionals. One of the areas where we're also focused on is what is happening when it comes to universities, when it comes to small businesses, getting help from the government. Now we're seeing more stories of the federal PPP program, major businesses getting money. A multi-billionaire out of Texas has received more than $100 million as a part of the small business program. He's also a top Trump donor. He's made it clear he's not returning any of the money. Now we found today that the Los Angeles Lakers received several $1 million. The LA Lakers, a small business, once that became public, they announced they're returning the money. This is just absolutely crazy. Joining us right now is Congresswoman Etta Johnson. And Congresswoman, seriously, I mean, you know, how can people trust this is real when you have a basketball team that, if they were sold, are worth more than $2 billion, qualifying for a small business loan?
Well, I don't understand that myself. As a matter of fact, there's quite a bit that I have not been able to understand, and some, hopefully, has been corrected. But it's the same old story. It is not fair. We're trying to hold their feet to the fire. We try to call attention and make it public so they would maybe be embarrassed that they are clearly ignoring what the intent of the money was for, and that was for small, low-income businesses that keep our economy going.
And not only that, we're hearing that there was a story that was done today. 95% of black businesses won't be able to tap any of that money. 91% of Latino businesses won't be able to tap any of that money. And so it's just, it is difficult to watch what is going on and to see the reality that the people who need it the most. In fact, I was watching the live stream for Vice President Joe Biden. There was a discussion among African Americans, and Senator Kamala Harris says there should be a specific set of money set aside for small businesses with 20 or fewer employees. I'll be honest with you, it's a little hard to fathom small businesses having 500 employees. That's small?
Not the small we're talking about. And I can tell you that we tried very hard to earmark it for small businesses. The questions that I'm getting every day from small businesses here who've done business with one institution for a number of years go to see about a loan, and they don't participate with SBA. And some of them are very large banking institutions. I'm just appalled of all I've heard about since this has been going on.
And of course, college and universities are also impacted. You know, Harvard University, first of all, early on, Congressman Matt Gaetz was highly critical of money going to Howard University, even though Howard University has a hospital where they were treating coronavirus patients. Well, Harvard University got several $1 million after it was disclosed. They were put under pressure, return the money, because they're sitting on a $40 billion endowment. More than $6 billion has been distributed to colleges and universities. And so, you know, how is that also being awarded? You would think that those who need the money the most will be the ones who are receiving it, not a Harvard that again can tap a $40 billion endowment, the largest endowment of any university in America?
Well, I just imagine that Howard's going to have more cases than what Harvard will have. It is very interesting that its statistics don't tell you anything usually but the truth. It's clear that it's the people who've been deprived all along of health care, of decent living conditions, of poor working conditions, who are the most vulnerable. And we always fall a disproportionate share in that population. And so we have struggled, and I don't know what we would have done if we did not have 50 members of the Congressional Black Caucus who has fought every step of the way to try to get some attention given to all of the things that we talked about. We will continue, and we're stronger now than we've ever been.
Let's talk about the funding that's going to those colleges and universities. The money is supposed to be help students with housing and other necessities, correct?
Yes, the students get a good proportion of the share of what colleges get for their expense.
All right, then. Well, look, we certainly appreciate the CBC fighting on behalf of so many folks. At the end of the day, the people who need it the most, that's who should be receiving the support. Unfortunately, that is not happening. And so we certainly appreciate it. Congresswoman Eddie Breeze Johnson, thanks a lot.
Well, I appreciate you bringing it to the attention of the public because we need the outcry. We have been on the phone. Of course, we've had to work on the phone most of the time trying to get all of this developed. But we need all the attention to the inequities that we can get so they will help us to try to keep the pressure to correct.
All right, then. I appreciate it. Thank you so very much.
Thank you.
I want you to like, share, and subscribe to our YouTube channel, youtube.com/Roland S. Martin. And don't forget to turn on your notifications.